All right. So I wanted to introduce this topic and actually touch on natural history studies and clinical outcomes. These are super important for when we think about clinical trials or just in general, whether that's a formal, very formal structured clinical trial or it's N of few or N of a couple. These are the things that really matter. And I actually stole a lot of this from friends and colleagues, because why reinvent the wheel? And they okayed it, so we're fine. And then, all right, here we go. So just to frame it, if you guys are not familiar, so NARS1 is classified as a neurodevelopmental disorder. It's actually super common to have a neurodevelopmental disorder, and a large portion of that is actually genetic based. And it's really a conglomerate of symptoms, right? So we've talked a lot about sharing with all the kids how different they are, how similar they are. And so it's really important that we're gathering that information and understanding those things and those symptoms that are part of this. So it can be kind of everything, this global developmental delay, which almost everybody, I'm gonna have to slow down because I can already tell I'm talking too fast. That is probably the first symptom that many families noticed with their kids missing milestones. Autism spectrum disorder, ADHD, different issues with how you learn or process information. Cerebral palsy can be a really broad umbrella for having issues with how they're walking, how kids are walking and moving. And so it just can show up in different ways. And so very overlapping and common features. Seizures can also be a part of this. And so that's the other thing where NARS1 falls into a bigger umbrella. We're considered a DEE, which is a developmental epileptic encephalopathy. So where the seizures are actually affecting how they're growing and developing. So just kind of shows like how one genetic disorder can fit into a much broader patient population. And this is also key to why all of those things matter and why those diagnoses, each of those individual diagnoses matter, not just the genetic diagnosis of NARS1, because that really should allow, at least in the US, it's different everywhere. The healthcare system is different everywhere, but it allows you to have that individual clinical support to treat each of those symptoms and each of those diagnoses in the system that you're living in and residing in. And then the other thing is for research. And so again, we're trying to understand what NARS1 and how it's affecting our kids as a group, individuals as a group, and that's where we come into natural history studies and clinical trials and developments and measurements. So a natural history study is really collecting the information over time to understand how the disease is developing, right? And then trying to pull out sort of similarities and track that throughout a period of time so we can understand it. And as we do that, ultimately what we're looking at is how do we measure change? So when we start now applying intervention and we think about clinical trials or we think about just an observational trial or you do or try something different, how does that make it look different in your child or in our population of children? There we go. So here's, some of you have probably seen this before. Here's what we know about, what's published in the literature about NARS1. So this actually was done by one of our genetic counseling students that we had last spring, where she cataloged all the symptoms that were reported in the literature, which is about 45. Oh yeah. So we know a lot about sort of these top 4 or 5 symptoms there that are listed in green, and know less about these red symptoms that we see there. It's not reported very often. It's not very consistently reported. Doesn't mean it's not happening, it just means it's not being documented, because you have to remember what's in the literature is a point in time, right? So it's just one instance of evaluating that child, and then that's being recorded and published. Or being published as a group. So it's really up to what that clinician is evaluating or what they think is important in the individuals that they're seeing. And then we've got a little bit of data from RareX, which is our internal caregiver reported data set. And this was, again, from April. We're actually up to 22 enrolled right now, so you can tell we're enrolled from all over the world. When I first presented 2 years ago, we had 10 and data from 8. So we've doubled in about 2 years, which is pretty good. And so what we know from what you guys have said about what's happening in your kids, this is with 15 individuals with a confirmed diagnosis of NARS1 because the genetic report is uploaded. We know that there's very similar things in terms of, how NARS1 affects the brain, the nervous system, muscles, and development. But the cool thing is, wait, I'm gonna screw this up. Am I gonna not? There it is. The thing that I like to point out that isn't reported in the literature is this digestive component. It's really prevalent in what caregivers are reported, and it's very rarely reported in the literature at all. It's the same thing with, like eyes and vision. There's only one case report of eyes being affected, and we're seeing that in almost half of individuals, right? So all of these things really matter when we start thinking about clinical trials and measuring what matters and how we report changes in different. The other thing I also like to point out is we actually capture regression, right? So this is something as parents, we all want to know, like, what does the future hold? And so this is an insight to, is there something that does change over time with the disease? And so the fact that we have people that are reporting this, and it could be a point in time or it could be over a long period of time, are things that we need to know about so that we can also, again, if we apply an intervention, either stop that from happening or slow it from happening. Let's see, wait. All right. So I kind of already alluded to this, right? It's super important that we have measures, but really what should we measure? And so the guidance that we've received is that it should be patient-focused, especially in rare diseases, because there's so few measurements that really we can tell a difference in. And so in NARS1, it's so important to know what matters to you and what you're seeing in your kids, and that's how we should develop those outcomes. And this actually is an FDA aligned guidance. I'm going to talk about FDA because that's what I know, and I can't possibly understand the regulatory efforts and capacity across the world, but that's what Ingrid's for. She's going to tell me what happens in the EMA, so we can align it. So the FDA has done a lot of work around aligning patient experiences and family experiences to incorporate outcome measures seamlessly. So quantitative versus qualitative, right? So quantitative, right, is the numbers, it's the count, and qualitative is really about how it's affecting that symptom and your quality of life. And we can do the qualitative and quantitative pieces through different aspects. So behavioral phenotyping, which is different assessments that are usually already being done in your kids every time you go and see your clinicians or consultants or whatever else they're called in other parts of the world, to kind of, again, capture the elements of NARS1, natural history studies, longitudinal data. This is really formalized. And then conceptual models, which I applied for a grant for this, so hopefully that'll come in the next year or two, is really interviewing parents and getting, again, like a research-based or study-based insight into what the daily life is like through open-ended questions and modeling, and then understanding impacts and priorities. So I did a brief survey. I think most people in the room completed this before this, so I'll have a little bit of data from that. And then how you're entering in those impacts and those priorities of what matters will kind of coincide with what we're able to then pull from literature or pull from natural history studies to make a positive impact on measurement and interventions. So I'm going to actually skip this. I don't like this slide. So how to select outcome measures. So clinical trials in general, have really been designed for big populations. And so because they've been designed that way, it has made it very difficult for really small, rare diseases to actually have and show a benefit when you apply an intervention. And so there's lots of ways to select an outcome measure to make sure that when you're doing it, providing an intervention, whether that's a therapy or whether that's a drug, that you are seeing when measuring a notable difference, right? As parents, you can watch your kids and see your kids. Sometimes that intervention really is making a difference. Sometimes you think you're seeing it. This is a way to standardize that so it's being measured in a consistent way across it. So you can do that through patient-reported outcomes, which is what RareX is. It's what some of these other surveys that have gone out are. It's observer-reported outcomes, so that would be like when you take your kid to physical therapy, right? And your physical therapist now says, oh, they've, now your child walks, 3 blocks with no help, right? Whereas before they could only do a block. So there's things like that. And then clinician-reported outcomes, which again, you're going to the doctor and they're doing a consistent survey every time, and that changes over time. So in the end, what you want is it needs to be fit for purpose. And so you'll start hearing that term a lot, or I'm going to start using it more and more. And then ideally, again, for us, it's a little bit of change for a big, big difference. And so again, that's part of the issue with really small groups, right? Sometimes just a small difference or small change will change, your child's quality of life, your quality of life. And then the goal of that is really to make sure that that's accepted by the regulatory bodies, because that's how we continue to further develop, therapies. And I'm hoping this is going to open up to us soon. This is the Inchstone project, and that's really what this is based on, is looking at validated measures that are measuring tiny little increments in change, right? So this could be a difference in going from being nonverbal to now saying, 3 or 4 words, right? Or from not being able to walk to taking a few steps. So it's designed to measure really, really small units of change, but to actually show a validated measure so that now therapies become more and more available. And it's based off of like SCN8A, these disorders that are very, very invasive. So they're going through the process to submit these through FDA to make sure that they're validated surveys. So I wanted to just give you a little bit of insight for data. So I sent this survey out. Actually, Kat sent this survey out for me a week ago, which is amazing. So in 1 week, we got 16 responses from our community. The goal is actually to make sure that we get more and more and more, and then we'll probably run it over periods of time just to make sure that those priorities don't change, those impacts don't change. So I'm going to talk about 2 elements of this, and then Kat's going to talk about 2 more in her portion. So the 2 things that I'm going to talk about are the most impactful symptoms, and then I don't remember the other one because I did this at 2 o'clock in the morning last night. So this was a survey that I created with some colleagues, and it's IRB approved. So this is publishable data, which is amazing. So this is with 14 individuals, and then the first question was what are the top 3 aspects of your child or the affected individual that most impact their daily life? So there's only 14 that completed the survey, so I had to exclude 2. But these are the symptoms that were reported the most common. And so you can actually already see from my little graph here that most impact, I know this isn't, I tried really hard, Kat. Thank you. In this deep purple, the first most impactful, in the blue is the second most impactful, and in the pink color here, the third most impactful. That really we see a huge grouping here in this cognition area, the speech area, and then walking. And then it kind of tapers off a little bit, towards the end. And it's really kind of hard to tell, like, is this a difference in age? Is this a difference in, location, like geographical location? But in general, we see a huge theme of like the biggest impacts on, your individuals and your individuals with NARS1 and your families. So it doesn't even matter how I rank them, right? They're all right here, which I think just validates probably what you guys have already known from talking to each other. But now you can actually put it in print, and when you put it in print, then it actually counts. I'm not saying that you don't count. I'm just saying to the rest of the world, this, now it's recognized. And so this is exciting for me because I'm a nerd, that it validates everything that I think we think about when we're talking about our kids. And very similarly, so this is the second question, right? Which symptoms or medical challenges of this disorder are most important to alleviate, improve, right? So again, if we were to apply a therapeutic, whether that's a drug or it's an intervention of like a therapy, what do you want to see change? And this really gives us insight to know how do we think about measuring that. Are there instruments to measure that through surveys or through different tests that could help measure those changes? Because this is what really matters. And so again, we see quite a bit of clustering, right? Here, seizures are floating a little bit more to the top, which actually is pretty easy to measure, thank goodness. But like speech, walking, and different cognition. So, and then we got a little bit of everything else in here. But speech, and I'll just kind of, speech is actually really hard to measure, especially in kids who have very few words, or use gestures, signs, or AAC devices. So there's a couple of, there's a survey called the ORCA survey, which is in RareX, which you have filled in, that gets at all of that stuff. But that will also help, right? And it's also help try to measure those differences because that can change over time. So I wanted to say thank you to everybody who filled this out in such a fast manner, and hopefully it wasn't too painful. I tried to make it a little shorter. But again, it gives us a really quick insight to like what's happening and what really matters. I think that might be it. Nope. I wanted to also throw this in there because I know, again, most of you guys have enrolled and participated in RareX. We've done it, I've done a kind of walkthrough of the things that really align with what is showing up on the priority and impact survey. So these are the surveys that align with the symptoms that you have all talked about. So it really will help sort of mitigate the pain points that come along with filling those things out, except for the Vineland, because I do understand that is beastly and everybody hates it, and that's fine because I have done it and it's awful. But otherwise, they really do help kind of align with those. I mean, the Vineland does actually. It has all the things. It has communication, it has development, it has behavior, it has everything in there. That's also why it's painful. And that's, if you haven't taken it, I'm doing another plug before we go back on the web with that to the bigger population. All right, and I think that's it. All right, 2 down, 1 to go.